Hi, this is Becky Keller with Elevate Core Health. I am a pelvic floor physical therapist and certified low pressure fitness trainer. Today I'm going to do a demo and some progressions with one of the low pressure fitness positions, Gaia. So Gaia is an unloaded position, or what we call a discharge position, which essentially means that there's a decrease or a reduction in gravity on the spine and through the pelvic girdle. So it's a really great position to be able to kind of take pressure off the pelvic floor. So if you're feeling symptoms of pelvic organ prolapse, that heaviness, that dropping down or descent, this is a great position to work with. It's also a pretty familiar position. It's the quadruped position, so hands and knees. And it's a position we use a lot as pelvic physical therapists as well as orthopedic physical therapists to really help with increasing awareness of the spine, core stabilization, shoulder girdle, and pelvic girdle stabilization. So it's an awesome position. So I'll just put back my hair real quick here so you can kind of see a little bit better. So what we're gonna do is gonna get into the hands and knees position. Okay. So with one of the technical basics in low pressure fitness is we work with our feet in a flexed or a dorsiflex position. So there's some research that shows activating the feet in this position with the toes that you get some deep core stabilization already starting to activate and work in there. It's also too because our pelvic floor and our toes and feet sit next to each other on the motor strip. So we can get some activation of those core muscles just from getting our feet into this position. So we want to make sure knees under hips, hands under shoulders. We want to be in a neutral pelvic or spinal position. So no arched back, like that anterior tilt like that we call that saggy cow position. We don't want to be in that posterior pelvic tilt or that scaredy cow position. We want to be nice and neutral. And then from there, we want to think about lengthening through our spine. So imagine a force coming out the crown of our head, or we have a string or cord pulling us to the opposite side of the room. Now we really want to get our shoulder girdle active, and we want to get that serratus anterior muscle, so that muscle that comes from the shoulder blade towards the rib cage here that helps us with that inspiration or inhalation when we're breathing, or that lateral rib cage expansion. So with your arms placed in this position, you want to think about gently rotating the arms so that the fingers are kind of pointing at least towards each other on a slight diagonal. And that helps activate the fascial line. You want to give a sense of pressing the floor away, or as if you're going to imprint your hands into the mat. So imagine they're glued there. And I also want you to widen or give a widening force at the elbows. So you can see a little bit here even with my shoulder girdle being able to active and stabilize a little bit. Now with the breathing, okay, so remember we're doing that nice lateral rib cage breathing, or we're breathing 360 degrees around, like an umbrella opening. And then when we perform the vacuum, the expiratory apnea or the abdominal vacuum, whatever you'd like to call it, remember with that one is we're exhaling all the air, we hold the breath, we close the nose and throat, so we're closing our canister, and then we take what we call a false breath. We call it a false breath because we're acting like we're trying to breathe, but there's no air flowing in because we've closed that canister, or we've made that seal. So in a level 1 position, we typically do a 3-breath cycle. So we're going to breathe in, and as we exhale, we grow and lengthen, even giving a little sense of that access forward or that incline forward. Inhale again. Exhale, grow, lengthen. So my head's my neck's in a fairly neutral position in level 1. Inhale, 3rd breath, and then we'll prepare the vacuum. All the air comes out. We hold the breath, close the nose and throat, and open and lift the ribs. Slow, gentle breath in. Then we can kind of start to progress where we add a little bit of more of a flexion motion. So our eyes start to kind of gaze down between the knees. And I'm still giving this sense of pressing the arms away. And I'm thinking about the spine right in between the shoulder blades, Gently pressing up towards the sky so we really get that serratus anterior working. Inhale. Exhale, grow. This force coming out the crown of the head. Inhale again. Exhale, and we'll vacuum. As we breathe, we're going to move our right knee forward and our left arm. So now we're in what we call an asymmetric position. We get some nice cross-body fascial work here. And this is, again, starting to get into more advanced work here. Inhale, exhale, and you can vacuum here. Good. There's also an advanced position from here, advanced Gaia. And what we do is we press and lift the hips and pelvis up towards the sky. The back leg, we're lengthening through the heel, so really getting a great posterior fascial line stretch. And of course you do that in the vacuum, so what that would look like. And then I would advance and do it again. Good. So back to symmetric. So here we're going to start to do a little bit more of advanced Gaia. So we're really going to be working our arms here. So arms doing a lot of the work, and we'll gently kiss the forehead down to the ground. So my arms are doing 95% of the work. Inhale, exhale. Whew. It's a really great arm workout. So who needs traditional push-ups when you've got Gaia? So it's really a great way to modify out of trying to do push-ups in that true plank position. So for someone who has pelvic floor and abdominal dysfunction, it can really help give you a great arm workout. So again, Gaia is an unloaded pose. She typically kind of comes in the middle of your flow. So she will follow a loaded pose, and she'll often follow a loaded pose where you're doing a lot of extension because obviously you're doing a little bit more flexion in her position.